Evening, everyone. Thank you very much for joining us. I think we are the last panel discussion before, I believe, cocktail evening. So hopefully we can keep you entertained for 30 minutes or maybe closer to 40 minutes, but we'll see. Before I introduce the panel and myself, I just wanted to say a really big thank you to Scott, to Henry and the LSI team. I think anyone who's kind of walked the halls of this very grand hotel over the last few days can see how much effort goes into engineering something like this. I believe this is the 11th edition of LSI Summits, and that means that over the years they've assembled over 10,000 executives, investors, startup founders, and I believe over 2,000 organizations. It's a really vibrant community of medtech people that have come together, and I think you can all agree that they've done an amazing job. It feels like things are happening, deals are happening, and from what I've seen, the kind of future of healthcare is kind of emerging before our eyes. So huge thank yous to Scott and Henry in particular. Also, forgive me if I refer to my notes occasionally. There's a picture of my daughter staring at me when I have to log in. So my name is Ben Moss. I should probably know that without looking at my notes. And I'll be chairing this discussion today. I must admit that I'm not a medtech founder. I'm not an investor, which is also a great shame. And I'm not an academic. I work for an agency called Dirt and Glory Media. We're a healthcare communications agency based out of Somerset House in London. We work with different healthcare brands, organizations and individuals to really help them tell their stories. And hopefully when we get it right, occasionally, we help them stand apart against their competitors, both from a kind of full service creative perspective, so brand building, but also from the PR perspective. And it's been amazing to see some of our clients here at LSI over the last few days, including Proximy and IQ Endoscopes. I'm probably going to forget some and get in trouble, but many other brilliant businesses are here today. Today we're here to talk about London's vibrant medtech scene. And I know that this is really a global operation and there are businesses from all over the world. But as a Londoner, having briefly met Nicolas and Carrie earlier today, I've already learned a number of things about just how vibrant London is. And I'm just going to introduce you both. Sitting here in the middle is Carrie Baptist, who is Chief Strategy Officer at Conception X, and Dr. Nicolas Huber, Director of Commercial Operations and Partnerships at the London Institute for Healthcare Engineering, and also Acting Director for KCL's Catalyst, which is the MedTech Accelerator, I think. Carrie, would you like to give yourself a much better introduction than I no doubt have?
No, my pleasure, and I'm really excited to be here. So Conception X is a PhD deep tech accelerator. So we are right at the heart of the intersection between the unbelievable technological innovation happening in the universities in London, but across the UK and Europe, and translation, building startups, helping them successfully raise seed, Series A, grow and scale. So we work with about 70 different universities in this country, but also across Europe. But our start was in London. We spun ourselves out of University College London, and most of the teams that participate in our program are from King's, UCL, Imperial, Oxford, Cambridge. So we're very immersed in the London and sort of Southeast Europe ecosystem.
And Nicolas?
And I'm Nicolas Huber. I am the Chief Operating Officer for the London Institute for Healthcare Engineering, which is a translational institute. It's quite unique in the UK and possibly in Europe, dedicated to taking medical devices to the clinic and the market. We see about 50 companies a year at this point in time. And though I am King's, it is an institute open to the rest of the UK. And we also invite companies from abroad to come and join us. We have a team of about 25 translation experts going from our own ISO 13485 QMS, which is certified by the BSI. We have our own health technology assessment team, our own clinical translation team. And apart from this, we also, being King's, we leverage the largest academic health science network, possibly the largest in the UK, which is King's Health Partners, which includes Guy's at St. Thomas's and King's College Hospital.
Thank you. I really want to sort of hone in on this London or Landon scene that we like to call it. And we were talking earlier about the serendipity of it, the closeness, the proximity, the density of not just incredible infrastructure and educational facilities, some of which you've mentioned, but also one of the most diverse patient groups in the world. Carrie, I was wondering, could you kind of sort of give us a view as to why, London is really, it sounds ironic, but London is London's greatest strength from a kind of medtech and entrepreneurial sort of foundations?
The density of the London ecosystem is extraordinary, and sort of the layers of it. And if you root into the universities and thinking about the labs where many of these innovations get their start, so you have Queen Mary in East London, you have UCL, you have Imperial, you have Birkbeck, the sort of depth. And Imperial is the top university in the world in terms of STEM. I mean, it's extraordinary, the density of talent centered in this physical space. And then each one of those universities has accelerators, medtech accelerators, innovation accelerators, digital health accelerators. Each one of those universities has special pathway collaborations with hospital trusts. So Queen Mary and St. Bart's, Imperial and the Imperial Health Trust, UCL and UCL, King's and Guy's and St. Thomas's. So as you're a academician working and building, whatever kind of new device, new technology, frontier AI model, there are these straight shot pathways to be able to test clinically in these hospital trusts associated with each university. And these aren't sort of small hospital trusts. These are the best hospital trusts. The league tables were in the papers this morning. These are the top hospital trusts in the UK. And then you have the wider accelerators like Conception X that then take and translate those discoveries into the market. And you have unbelievable VCs, Cancer Research UK, these kind of really innovative funders that are seeding in at the very early stage. You have the role of governments, you have NHS innovation networks and trusts that are then mainlining those startups into the sort of southern England, all happening at the same time within sort of 15 minutes of central London.
When the tube is working, right?
When the tube is working.
Yes.
I struggle to think of anywhere else in Europe which has that density and interconnected, players.
And Nicolas, we were also talking earlier, it's not just about proximity. It's also about there's a kind of collaborative spirit between institutions that maybe, and I don't want to get into a UK-Europe debate here, but there seems to be in London a real sense of willingness to collaborate, to share ideas, to share data.
Absolutely. And as I was telling you earlier, when most of our recent spin-outs, especially in healthcare, are collaborative. Either the IP was co-developed with some other university in London or with one of our partner trusts or with some trusts that are not necessarily our everyday partners. But so much of the IP generated is collaborative. And so you see that it is real need-driven. It's usually with a partner hospital. That's absolutely key, right? And the fact that hospitals can then collaborate, well, not bashing any system, saying if anything is better than the other, but in the US, hospital systems are actually competitors to each other. So they will never actually actively share data or share IP. But this is not London or at least the UK, right? Here it happens. So you will see in spin-outs that they have on the cap tables maybe 2 trusts and 2 universities. And this is quite rare. And we're talking about, again, in London, this happens so much. It's very, very often.
Yeah, it's not rare here.
What?
It's not rare here. In other geographies, that might be quite unusual. But we send, we get teams from universities. They've already done the Imperial Medtech Superconductor, and then they come on to Conception X, and then they go over to the Venture Builder. There is these sort of interconnected, linked up pathways from lab to market. To my knowledge, it's incredibly unique.
And I think it's really interesting. And it's funny, I don't always associate with London being open-minded and collaborative necessarily across industries. So it's really interesting to talk about it. Nicolas, I just wanted to talk about LSI for a minute.
Okay.
It's an incredible building, opposite the Houses of Parliament. We're talking about a sense of place here. I wanted to sort of understand architecturally and even metaphorically, what does that building mean and how does it kind of foster a sense of innovation and collaboration, and it feels very purposeful in its design and its location. I just was wondering if you could tell us a little bit about it.
Well, thank you for that. The LSI is a building with a mission. Its mission is to drive impact to patients. And because it's a university with a civic duty. It's a public, of course, institution. We're a university in the UK. And so all of LSI was designed with the idea of bringing all the stakeholders of medtech into one place to collaborate, to accelerate innovation to patient impact. That's effectively what we're doing. And there is method to how it has been designed from pure education of undergrads and postgrads to the entire translation team I mentioned earlier, to a floor dedicated to spin-outs from across the UK and abroad, and also to corporate partners with NVIDIA and Siemens Healthineers having offices in the building, which they use, of course, to collaborate with both our academics and the spin-outs that we bring into the ecosystem. And it is 9 meters away from St. Thomas's Hospital. So it's a completely unique place that we know of. And because of the word serendipity you used earlier, it's a place where that happens when you've got everyone in the building, from BSI, our partners who are often there, to investors, to corporates. And having that where it is, which you said the location, is a testament to the fact that we strongly believe at King's that medtech is a real business and it is a real driver for patient impact. It's not just pharma. You will have heard that before, underinvestment in medtech, not the big exits when the impact is there. This is a statement with a mission.
I'm learning more and more that there's lots of unifying threads between both the work that LSI is doing and Conception X. But I guess from a layman's perspective, one of them is you both work really hands-on with young, not necessarily young actually, that's probably, but scientists, clinicians, and you're a real enabler of those individuals to sort of think bigger, or certainly think more commercially, I guess. Yeah. How do your kind of respective programs equip these individuals with the skills to have a brilliant idea in the lab, to move probably from the boardroom and then to the point you're making, Nicolas, to the bedside for patient impact? So what are the sort of skills you're equipping these people with?
And I think there is this, if it was 10 years ago, there'd be a skepticism. A scientist can be a CEO. It was the reserve of MBAs. And more, as we're in this moment of unbelievable sort of scientific revolution, and there are these advances in AI, in materials, in biotech, which are absolutely reshaping industry and what's possible. You see more interest from scientists to foreground impact, to think commercially, but then also I think an acceptance from investors, from industry, to see companies which are led by technical talent. And so we work exclusively with scientists. We back that talent, and we work with them very early on in the lab to help them, think through the commercial potential of their innovations and develop it further. And the core traits that you have as a sort of a brilliant analytical scientist, you do 1,000 tests in the lab and one comes good. They're already resilient. They already know how to persevere. They already are able to think analytically from first principles. They learn quickly. They fail quickly. They iterate. All of those core traits are there, and we simply equip them. We give them essentially a mini MBA to equip them with the business skills they need to build out their business and scale and build a strong founding team around themselves. I think there's a shift in idea of what a PhD can be or what a postdoc can be, and the role of the university in this commercialization process, and shifting pressure from government, but also from the university structures themselves, an openness towards this. You see that cultural shift in the labs.
I guess there's also more enablers. There's more people, like yourselves, helping and being hands-on and giving that knowledge. Whereas I guess previously, 10, 15 years ago, you'd have a brilliant idea in the lab, but okay, well, how do I take this to market? What is the commercial roadmap for this particular piece of technology? Is it? And I guess the same on your side, Nicolas. The information that you're, equipping young clinicians with. And I know there are now countless examples across the NHS of, entrepreneur programs, some people, taking brilliant ideas, particularly, during and post-COVID, brilliant ideas and getting them to bedside quicker. Have you noticed like a cultural shift? Are people now, I've actually got a really good idea now. What is that route to commercialization?
There absolutely is, and there are multiple drivers for that. I mean, if you're a researcher, you live off grants, right? I mean, that's in the UK, at least. That's what you get a grant, you develop something, you write a paper. in its wisdom, the government has actually now made most grants translational. If the time when so much blue sky research was funded in the UK is probably over, and so there is so much drive that when you apply for a grant, you know how you're going to commercialize, and you have to write clearly what the impact of this innovation hitting the market will be. Now, if you're an academic who has never been to a Conception X, has never been to a LSI, we do only medtech, right? We're only medtech. Well, Conception X is across the board. Then you don't actually have the answers, because we work with those grants, right, to write those grants anymore, which is a bit surprising, right? So because of that, you see that shift. But also, I think that things have generally become so much more pressing. You know, healthcare is in crisis globally, you know, from, of course, environment that, you know, Carrie is doing a lot more in as well, is in crisis. People who are going into academia, you cannot be going in anymore because, oh, I'm just doing a PhD anymore. You are reading things and doing things that are there to improve the human condition now, really. And that's what we're seeing as well. We're seeing that people are coming in actually dedicated to seeing their work make impact. So,
but I do think that there's a need for specific support for scientists that are seeking to make that leap. It isn't the same as a sort of a generalized accelerator, you know, writ large. It is a specific pathway from scientist to founder. And so this is why Conception X exists. And we provide the blueprint for these scientists who are, you know, want to be more impact led and who are seeing these discoveries and want to see them translate to patient and clinical impact. And then we also provide an interface for industry that wants to engage earlier, that wants to, I want whatever, 10 new devices in this area or that theme. What's the best? Give me, source me the 10 best, the 5 best companies that are building across Europe in X space or Y space. Same with investors, same with governments that want to expand the pipeline, that are investing and see the industrial potential and the economic potential and want to invest in it and want to sort of counterfactually expand that pipeline of scientists becoming entrepreneurs, founding and building here in Europe.
I just want to sort of pick up on that. We were speaking earlier about it, but this idea that clinicians and researchers and people in academia, they actually have so many traits of what you would consider a classic entrepreneur. They fail fast. They can take criticism. They're very creative, and I guess that a lot of those skills would translate very kind of seamlessly to the boardroom in front of investors. I wanted to sort of hear your take on the kind of the characteristics of the modern entrepreneur that you see through the lens of the respective organizations.
I think the first switch that they have to make first is that when you're pitching to investors, okay, you must have a plan, but you're effectively pitching something that is still gray, right? Still not exactly certain what it's going to look like in 10 years' time. It's all about the conviction, about the character. It's all about the founder, as Carrie will tell you. And they have to switch out of being a dyed-in-the-wool academic of science being black and white, right? Once they've made, though, that leap, that I believe in a future that I can't actually define yet, right? Once they have made that leap because of running, mental experiments, because of all the research that they need to do to prove anything, to put anything out over their years of work, right? They are eminently placed to be running a spin-out, to be running a startup. And you get, if you're an academic, I'm an ex-academic, you get a feel for things, you get a feel for numbers, you get a feel for situations from sparse data sometimes, right? And they have this capability. And we see that a lot from academics. And the other thing is they learn very quickly. A good academic who's, managed to develop multiple technologies, they learn very quickly. They think that the business side is rocket science, and then you explain to them, well, you're doing surgical robotics. It's probably easier, the business side, So, yeah, absolutely. I think they're very well equipped.
The business is a skill that can be learned.
Yeah.
You don't pick it up overnight, and there are these mindset shifts. The sort of the comfort zone for a scientist is in the lab with a book to get them to, talk to customers. Do it now. Don't wait. But that's, you have a problem. Either you have a sort of, a solution looking for a problem or a problem looking for a solution. I infinitely prefer to have a solution looking for a problem because there's true novel technology there. And I'm thinking about one of the teams that that sort of recently came through the program, and it's a company called Respiro Diagnostics, and it's you breathe out, and it's within sort of 2 minutes can tell you if you have lung cancer. And it started as a COVID device, and then because you have the founding team are stacked PhDs. And so, yes, they absolutely sort of pivoted, and the COVID sort of market moved on, and and now, but they realized the biomarkers that are in breath, and because they had that deep, world-leading technical expertise, they were able to pivot this device so that it can detect lung cancer, it can detect other sort of COPD, other lung. They just found some really interesting results on breast cancer. The market for this device is extraordinary. It is truly world-leading in terms of the technical backend and the science behind it. You can shift how you diagnose lung cancer for something that requires a tissue or a blood sample to an annual puff. I mean, that's wild. But if they were a more traditional founding team, they wouldn't have been able to execute those technical pivots. It is... I'm really happy to be led by scientists and help them figure out the customer discovery in the market.
I guess that's what's amazing about medtech and health tech is that they are, there's very few sort of manufactured problems. Clinicians, scientists, researchers know that there's a problem. They want to find that solution, and I guess that's why, the work that you do is probably really interesting. We were talking earlier about. I'm sure you both must have a front row seat to some incredible ideas. I know on every panel discussion across the world there are conversations around AI at the moment, but I guess both of you must be seeing, particularly in London as well, when you talk about the diversity of patients, the NHS network, access to data. I guess you must be seeing really, really interesting and thought-provoking and I guess purposeful applications of AI. I just wanted to sort of pick up on that. Are there any things that you're seeing from a trends perspective or any businesses that you've gone, wow, that's pretty amazing?
I mean, we've got a King's and UCL spin-out called Hologen. If you look it up, that's pretty wild stuff. I would go back to the point of, why then London, because AI now, everyone is investing in it, and if you think if you've got the compute power, you can do a lot. But, the diversity of the population is a huge asset, which ideally, and with the way that trusts are now starting to collaborate as under unified secure data enclaves and all the things that are happening in London, we hope to be attracting foreign investment and foreign partners and corporations to leverage this data, right? For the benefit of the NHS, because in the UK, all the clinical data is owned by each trust, right? It's not even owned by the patient, which is by the way, it's a good thing that's not owned by the physician themselves or some other entity, right? So, with that in mind, we have then, if you add all the elements here, we've got a massive amount of excellent talent in AI in London with all the universities. We've got a lot of compute in London and surrounding it with all the partnerships. We've got the secure data enclaves and the governance layers that are being put around all the data in London, effectively across all trusts, which is basically the bedrock for fantastic developments we can't even think of yet. We can't even imagine. So back to the conversation of why is London such a fantastic ecosystem? I think on the size and the number of patients we're covering and the diversity is probably unique, probably.
We were having the conversation about capital efficiency and why startups here can go so much further on a smaller raise. It's a few million gets them into clinical. And yes, it is the unbelievable concentration of talent and the sort of lower operational costs. It is also the infrastructure provided by the NHS and these trusts. So if I want to, we talked about the Foresight model developed by King's and UCL, trained on the NHS England secure data environment. So that's, trained off of complete population-wide 57 million patient records. that is hard to replicate. There aren't very many data, national level health systems where you have an integrated data set like that. And if I'm building a startup and I want to access it, it costs me like £5,000. It costs nothing. So there are these infrastructural investments that the government is making in genomic data and the sort of strategy on that from the NHS tenure, in the the sort of health service data research, the National Health Data Research Service, that the Wellcome is co-funding up in Cambridge. It's a 500 million investment the NHS is making similarly to knit together these data sets. There is unusual sort of ability to build foundational AI. And I think there's an important distinction to make between sort of surface level, everything sort of a little AI wrapper, and foundational, true novel algorithms, deep innovation, which you only get when you have access to high quality training data, the right evals, the talent that you have at DeepMind and 11 Labs and Synesthesia, and then these other sort of supporting, ecosystem elements.
Just to pick up on a couple of things. So it feels like London has an amazing culture of innovation, and also I think showing impact. A lot of the people you work with know how to show the impact of their technology. I just wanted to sort of flip onto the investor side of things. How do you kind of, when's the right time to put an individual that you work with in front of an investor? What does that exchange look like? What does the kind of networking look like from your perspectives to the investor community? And how do you kind of bridge that gap working with these individuals and groups to do that? What does that sort of program look like from your perspective? Perhaps, Nicolas.
Should I?
Yeah.
Great. So what we're doing at LSI, we've got a national program, very much like Conception X's, but ours is dedicated to medtech and it's very late stage. It's called the Medtech Venture Builder. Contrary to Venture Builder being a very early stage kind of program, ours is a very late stage kind of program. And how we've approached it is with the idea that capital is becoming harder. Where we've approached it with the idea that those companies, if and when they're raised, they will have to be capital efficient. They will have to hit their probably first in human, we're talking medical device here, so their first in human or at least some early clinical validation from their seed or, late seed sort of run. So with a little money go far. And we can do that because within LSI, we provide all this support, including access to clinicians and all these things ourselves, right? We have the links, we've got the networks, right? So we sort of de-risk the ventures. Having said that, we put them in front of investors from day one. I mean, the whole point is that it's not that, I've met you today and I'm going to have a deal. As every investor, worth their salt will tell you, they want a relationship with the founders. They want to see that those founders going, say, even through our program, can execute, right? Because it's all about execution, as Carrie said earlier. It's not about just the technology. So we even, in the later parts of the program, we even partner each company with the VC that is not there to invest. It's all behind a veil. It's like they don't even tell their ICs, right, that they're there potentially. All they're doing is they're stress testing the business case, right? Do you have something here that if you go and fundraise, someone won't be able to pick holes in anymore, which is not the same as training you to pitch. Right? So we are coming at it from the point of, can you be capital efficient? Can you live with little? Can you do this with not having so much money available as we did 5-10 years ago in the market, right? So that's our approach.
I guess that must be music to people's ears in this room, I guess, that these people are coming ready to the boardroom to really pitch their hearts out and know that they have a robust and capital efficient business that can actually make some of these investors money. Carrie, is there anything you wanted to add on that?
I think another similarity between what Nicolas and I are doing is our programs are long. You're working with these companies for 12 months. We're working with them for 9 months. At this early stage, it's about talent. It's about relationships. It's about really looking under the hood to see what's there. It's about seeing the pace. How much ground do they cover in that period? I want to see how they run a little bit. And we work really closely with investors. We work very closely with XTX, but then also others, and industry. So we bring in NVIDIA and GSK and AstraZeneca and to work with these teams to do proof of concept. Exactly. It is we don't talk about the technology. It is the business model, it's the customer, it's hammering that, and so that it is a de-risk sort of structure around them, an ecosystem of support and introductions. So it's a viable, strong commercial proposition.
And I guess that's true mentorship, what you're doing. That's true partnership. The knowledge and the work that you do with these people for a long time is really, it's not just, you can kind of trivialize it, equipping it for commercialization or whatever it may be. These are partners of yours and people and presumably friends that you work with every day to make sure that their fantastic ideas go from lab to bedside. It's amazing what you're both doing, and the sort of
we're mission driven. We're not
no points, right? So it's not about money, and I'm not saying, I'm saying it in the room on investors. For us, we are de-risking your investments if this is a room of investors, right? Because someone has to do it. This is a difficult journey, right? This is a difficult journey. So we are working to put those founders in the best possible footing on day one, effectively, when they're out there.
Amazing. We don't have very long left. I feel like we've covered a lot of positives about London, and I was going to go to the negatives, but it doesn't feel quite right, to be honest, because I'm from London and I love London.
Strikes, tube strikes.
Yeah, tube strikes. I could go there. Just a final thought really is you come into contact with so many interesting people from the lab, scientists, PhD students, clinicians from operating rooms from the NHS. I was wondering, in London, is there a kind of a sense that there's a London entrepreneurial spirit, or are these individuals, is there something kind of maybe unquantifiable that makes them feel like they're from London and they have this, this proximity and density and access to all of these amazing sort of organizations? Can you see it? Can you feel it?
We can, because I can, because King's is the biggest medical educator in Europe by far, both from a medicine perspective and a nursing perspective. So effectively, every single doctor in the UK probably has spent a year in King's at some point. Literally everyone I meet is like, oh yeah, I was at King's in 9, whatever. Yeah. So they know that this is happening, and King's is at the epicenter specifically for medtech. So I see it personally from where I stand.
And so we work, ExceptionX is, cross deep tech and cross university. So I get to compare, scientists that are coming from Unternehmen to University College Dublin and everywhere in between. And there is absolutely a hunger that you see with researchers who are based here. They're not waiting for me to present them with an opportunity or give them a grant, or they are hungry. They are on their email, sending me follow-ups. I want to be, they're builders in that way. And it's the culture around, it's in the labs. It's the norm to build a startup. It's the norm to be thinking about these questions. And it's that sort of positive social contagion.
And then I guess on the flip side, one of the huge challenges, I think it was alluded to in the NHS 10-year plan, is how do you retain that talent? How does London keep hold of it and not lose it to other countries, lose it to other organizations? How does London kind of keep its best talent here so that, London can continue to flourish as a medtech community?
The global talent visa is hugely important, right? And so be able to keep those students, if you're attracting the best and brightest, you need to be able to keep them here. And mechanisms like that are essential.
And I guess this is why, LSI and ConceptionX are doing just that as well. You are retaining talent by the very nature of what you're doing in London and you're pushing these people through the programs, I guess.
The announcement hasn't gone out, but it is in the public domain because it was advertised, but we will be hosting the first surgical innovation fellow from the Royal College of Surgeons at LSI. So the Royal College of Surgeons has instantiated this fellowship for a surgeon to leave practice for a year to learn how to do innovation effectively and translation for the benefit of surgery. And the assumption is, it's not even an assumption, it's a given that they expect that they will remain surgeons and will drive innovation in the field having done their fellowship. So our position, and I'm telling this to my team because we open up positions for LSI, for my team, right? And because we now have a name and a standing, right? People apply. And I tell them, be careful if you're hiring from the NHS because it is not right. My view is we want to equip clinicians and physicians to be more adoptive of innovation. If they see innovation, bring it in, right? Not just do it just because you need to also leave the NHS. That's not the plan. Okay, so we are as best we can. We're trying to retain that talent within the NHS.
No negatives on London this evening. But just thank you very much. I think we're out of time. I just thank you so much for enlightening us about the work you do. It's amazing, and it's really nice to hear the sort of the mission driven and purpose behind it.
Thank you.